हेलो। हेलो डॉक्टर साद। डॉक्टर साद, today we have a 20-year-old male.
I can hear you, but I can't see you. Yeah, we can see you and hear you, and we've got this man standing next to you who looks familiar.
Okay, that's good. We have a male
Huh.
who came with us with the complaint of something coming out of anus.
Hello, we can't hear you.
Hello.
हाँ अब आ रही है.
And bleeding PR for last one altered bowel habits for 6 months, alternating with diarrhea and constipation.
What's the age of the patient? Sorry, 20?
20 years.
Okay.
But he don't have any significant weight loss in last 6 months. On abdominal examination is normal. On inspection DRE was normal. However, on proctoscopy there is a internal hemorrhoids at 3 o'clock, which was there was no active bleeding noted.
Thank you.
Now that you've got the cause in this patient, Paul.
Yes, sir. Yes, sir.
They've done a rigid sigmoid at 20. Do we need to do a colonoscopy?
In the UK, we wouldn't. In the UK, we would not do a colonoscopy. We wouldn't even do a flexible sigmoidoscopy.
Yeah, you would demand. What I meant was, firstly, I mean, this is a debatable thing. In Pakistan, I don't trust the rigid sigmoidoscopies at all.
Yeah.
Okay, where people have told me that this is polyp or this is XYZ, it turns out to be totally different. So it depends on who's done it,
Yes.
number one. Number two, we are picking up a lot of early cancers. 20 is not an age when you don't see cancers in Pakistan, especially when patients present with bleeding. So unlike what we did in the UK, and I totally agree, I think the question here is, do we need to do a colonoscopy or just a flexible sigmoidoscopy? I think in somebody who's got flesh bleeding PR, a flexible sigmoidoscopy at 20 is good enough.
Well, I would agree with that.
Yeah, okay, but
flexi-sig
rigid
would be
sigmoidoscopy for me is an absolute no-no,
Yeah.
but I don't know about Paul.
Well, in our clinics, what we tend to do, proctoscopy is acceptable, but if someone comes with fresh PR bleeding, it's always best not to do the rigid SIGI, because with the incidence of inflammatory bowel disease being more prevalent in the UK, there is a lot of people who cause a lot of issues with trauma, etc. So it's best to leave it alone and do. If somebody was seen in clinic now, I would then do a flexi-sig within the next 2 to 3 hours that day of being seen in clinic with someone with this symptom.
Yeah, way back in the 90s where I was trained, we used to have flexible sigmoidoscopy in our clinics.
Yes.
So immediately as you came and you told me you had blood like this, they would go have an enema and we would do a sigmoidoscopy in the clinic, but flexible. I am an anti-rigid sigmoidoscopy person totally. I feel that should be really now out. With the availability of flexible scopes, that should not be there anyway. So here obviously we are doing a colonoscopy for the course purpose as well. But for the debate purpose, Paul and I agree with Paul. Flexible sigmoidoscopy is what we could have easily done here. Saves the prep and it's easily done. Okay. Right, Paul?
Okay,
Go
my
ahead.
friend. Sa told Barbie not to come. Excellent. Can this just come this way just a fraction? That's brilliant. Lovely. You happy?
Yes.
Good. So what talk are you going to do? What are you going to do now, my friend?
Talk to the right, clockwise talk.
Yeah, clockwise talk. Excellent. So lift it over the top. Great stuff. Keep going. Look what you've got here. Keep the scope straight. Allow the anti-clockwise torque to come in and draw back. Now neutralise your image. There you go. Good man. Let me just pop this here for you. There, that's better. Excellent. Well done. Excellent. So not clockwise, anti-clockwise. So good. Good. More. 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 Well done. Excellent. Well done. So where's the lumen? 12, 3, 6, 9. Where's the lumen, my friend? Okay. Excellent. Nice and slow. Keep going. Keep going. Keep going. Now, what are you going to do? Big wheel back. Keep it coming back. More. A little bit of air. Air. No. Keep it coming back. A little bit of air. That's good.
Good morning, Paul. Can you hear me?
I can.
Okay. I wanted to ask about the position that our colleague is holding the scope.
Yes.
Is that the correct position?
There is nothing prescribed to actually say correct position. For me, this is a comfortable position.
Yeah.
If that makes him comfortable, then that's fine. The thing is that you have this scope here, it's limiting. If you have the scope the way he's got it here, it is actually progressing nicely. The thing that you've got to do is come in a straight line, and this is the direction that you need to come in as much as possible.
Okay.
He's making excellent progress. So when someone's making very good progress, regardless if it isn't to the way that the person who stood next to them, that they do it slightly differently, the main thing to do is that there is more than one way of getting a scope around, as long as it's done safely. And the main rule here is just to show people different principles. If the hand slides forward like it's going there, then you do lose the directional force. So it's just gentle reminders, that's all you need to keep doing. So overall, as long as, if he's comfortable, the patient, it should be reflected in the patient.
Okay.
Just up. That's it. Yeah, big wheel back. So if it won't go all the way up, what you can do, right, is pull the little wheel forward or the little wheel back. There you go. And then what happens then is that you go counterintuitive, and then the lumen comes into view. But then once you've got that, you let go of the little wheel, and then the scope will go forward. Just let go of it, the little wheel, let go, and it stays in view. There you go. It just lifts it over that fold for that brief period. Well done. Take your finger off the blow. That's good. Excellent. Keep your hand back. So to get it round, there. See the torque? A little bit more torque. And we'll, no, let go of the little wheel now. That's good. And let the scope come natural. Back. Little bit of air. What? Just stop a second. What you're doing is keep moving the wheel. Okay? That's. If you keep moving it, it's a bit. That's the lumen. And every time I move the wheel, it has an effect. Then I do this. Then I do. But that's where I need to be. So you need to just slow that down. Take it back a fraction. Now you can see where you need to go.
Upward and anti-clockwise.
Yeah? That's better. Well done. So the lumen is down and then up. So it's big wheel forward. Too much, too much. Excellent. Now go forward. Keep that torque on. What's happening is that you've got the torque on. Okay, so you turn the scope and then you let go of the scope and then re-grab it. But while you're doing that, because you've got the torque on, this is the scope and then you do this. As soon as you let go, it returns and then you re-grab it. And then you're thinking it's going to stay in, it's not going to stay in place. So what you need to do is start with your thumb further round, bring it round, and then you can continue. Okay? So if you want to put anti-clockwise on the scope, start with your thumb here and bring on the scope. Okay? If it's clockwise you want to do, start with your thumb here and put it on. Okay? Well done. Thank you. These guys freeze. That's going the wrong direction. The lumen is actually down. Get a direction for the lumen. So the scope is here. We bring it back. If you look, see the fold. The fold here, just to the side. See how it sits. See how the fold is there. So what we've got is an idea already where the lumen's going. Where you want the scope to go, I want it to go clockwise. So clockwise is draw the big wheel back slowly, clockwise torque, more, and then the scope will go forward. Once it makes that bend, I know it wants to go to the top, keep going, and it's round. Okay? And all the time it's going in that direction. If you notice, I bring the scope here and I keep it here, and it's always going in that direction. Good man. Torque, hold the scope here. That's it, you've got it. Good. Excellent. Can you see where the lumen wants to go? Well done. Excellent. Well done. Keep going. Keep going. Well done. Yeah? Happy?
Yes.
Good. That's it. Keep this hand here. Keep that torque on. Yeah? Better. His feet are moving a little bit, so that saves a little bit of pain. Now what you can do is as you come round, hold on to the scope, hold on to it, do not let go. Do not let go. Hold on to it, do not let go. Don't do that. Big wheel back. Yeah. Big wheel back. Great stuff. Then if he finds it uncomfortable, what we'll do, we'll ask him to come on to... Keep it going. Keep it going. And clockwise torque. Go on. Clockwise torque. Go on. More. More. Start with your thumb at 6. No. Ring it round. Okay. Ring it round. And draw the scope back. And then forward again. If you could come onto his back. Yeah, onto his back. The reason for coming onto his back, it will change the orientation, the direction that it's going. Okay? Now once he's onto his back, if you draw the scope back a couple of centimetres, not anti-clockwise, keep the toe, keep the torque on. Now, what we need you to do is the actual opposite. Okay, big wheel forward. So move. Okay. Now let it come back. Let it come back. Neutralise that. And big wheel forward. And anti-clockwise. Let the anti-clockwise come in. Keep it on. Keep it on. And then clockwise. Now there you go. So now the scope is nearly straight. Keep it coming back. Okay. Excellent. And try once more. So where's the lumen? See the folds? See the folds? One's going. Excellent. Keep the hand low. Anti-clockwise. Let me just show you again, because I just need to, if the scope is here and you've got the actual lumen there, don't worry about the angulation here. If you've got your hand up here and it's burying down the scope needs to be kept low. So you're going in the same direction all the time. If you keep it in this direction, in this plane, okay, it will go forward. See it? Let the scope come back. Now remember from yesterday, had this torque where we had to put in a couple of clockwise loops into the scope, and that's because you change your position, you keep going in this direction all the time, which is a corkscrew. So then we have, okay, we'll just get it round this little here. Watch the scope, watch the screen. So as we bring it round, you'll see the lumen, it wants to go here. If I bring this up, does nothing. Rotate. the scope. Big wheel back. See it? So I'll take it back to here. You do it. Just rotate the scope. You're going to drop back if you're not careful. So, again. Now, just rotate the scope. Slowly. There. Big wheel forward. Okay? Now, don't go forward, draw back. Keep that torque on. Draw torque. All I'm doing is encouraging which direction to go. Don't let go of the scope. Suck. Suck. More. 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 No, no, I'm stopping you. Suck. Big wheel forward. Now you can go back in and do that once more. Okay? Keep going. Excellent. Keep it going anti-clockwise. More. More. Good. Now, advance. Suck a little bit. Advance slowly. Keep going. Excellent. Better. Better. Keep going. You're doing really good. Keep going. Once you get past this fold, it is again this rotation, yeah? So keep going. Go on. And once you get past that fold, yes? No. Stop. Keep it like so. This is the important bit. This, you lose it all. This, it has to be in this plane for this to work, see? If you do this, it goes off. This needs to be here to make that work. Great. Now, draw back. Keep that torque on. Suck. Suck. Big wheel back. Big wheel back. Great stuff. Suck. Suck. More. More. Suck. No. Suck. Suck. That's enough. Great stuff. Now go forward. Get the hand closer. Hand closer. That's good. Great. Now you can go. Well done. That's better. This has to be like that. Yes. Has to be. You're bringing it back up here, so it's this. Good man. So the way to do that is just let the hand sit down. Good. Back and forward. Yeah. Good. Keep going. Sorry?
Release the spasm.
It's not spasm. We've got you to cut down the air. Spasm, it's not.
Lumen is collapsed.
Lumen is now open. It's lack of air. It's what we call, it's never been in before, so the bag opens in front of you as you insufflate. Okay? So let me just help you. Okay, he's a little bit uncomfortable. So all I'm going to do for you, if we look at this, I tend to ignore it an awful lot, but if we actually take the scope, reduce that down a little bit, so now I'm putting a little bit of clockwise torque in, bit more, bit more, bit more. Now a little bit of anti-clockwise torque. And if you look, I don't look at this thing over here. You tend to stare at that an awful lot. Ignore it. Okay? That is only for when we want to demonstrate something for you. Okay? Now, your lumen and the scope is perfectly straight. Use the scope. What? See? Use the scope. Keep it in this line if you can. This, it will help, but not as much. If I do this, the scope will continue to rotate. So don't draw it back. Do not draw it back. Get the luminal view, which is there. A little bit of air. Fishing again with the wheels. A little bit of air. That's it. Now, come back and you'll see where the lumen goes. See it? It's off to there. Now where's the lumen? Okay. Well, you keep on the torque. You're very reluctant to keep on the torque. That's better. Keep going. Well done. Keep going. Well done. Now you're exactly where you were a moment ago. A little bit of air now. A little bit of trap the scope. A little bit of air. Good. There you go.
Paul?
Excellent. Yes, sir.
While after reduction, while we reinsert the scope, should we all the time have a little bit right-sided torque, like clockwise torque?
No. The torque you finish on, whichever it is, if it's clockwise or anti-clockwise, the thumb stays in the same position. You advance the scope then for 6 inches, 150 millimeters or so, and then you actually can then start to use torque steering again. You never, ever, once you've withdrawn and reduced the loop, start to use torque steering, because you will reform the loop.
Okay, okay.
Excellent, my friend. How does that feel now? How does that feel now? Happy? Well done. Good. Keep going, my friend.
Paul,
Yes, sir.
I just want to confirm while crossing the hepatic flexure, kindly explain it to me.
I can.
When crossing hepatic flexure,
Yeah.
kindly explain it to me how to pass it. Relax. Now we are in transverse colon.
If you believe the scope guide. So big wheel back, ever so slow. Get your head under there. Forward. Big wheel back. Further back. Further back. As far back as it goes. And then there.
This.
Okay? Keep the torque on, draw the scope back. Keep the torque on, draw the scope back. Anti-clockwise. Anti. Big wheel forward. Suck up.
Here we should give right clockwise torque or anti-clockwise torque.
Right, the particular torque for that, for the splenic flexure, is I try to put it anti-clockwise in as soon as possible. reason for that is to try stop the actual apex going underneath the diaphragm. Now just advance, my friend. Just advance. You don't let go of the scope. You're letting go of the scope. Keep advancing now. Now because you've done it, it will stay in view for you. Advance. So if you remember yesterday, we had the patient on the back. You had them on the left hand side, then I said put the patient on the back. And this is the splenic flexure. It's actually opened up nicely. So keep going, my friend. Keep going, nice and slow. It's the air that will cause the problem, not the scope. Keep going. Keep going. Keep going. Suck. Brilliant. Keep going. Keep going. Excellent. Turn your shoulder this direction. Excellent. Good. Let the scope come round. Let it come round. Let it come round. More. More. Big wheel forward. More. 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 Now big wheel back. Go on. Go on, big wheel back. Let the clockwise torque come in naturally. All the way back. Anti again, clockwise again, anti again, clockwise again. Right. That's brilliant. So, just get you there and draw the scope back. Now, release the big wheel just a fraction. A little bit of air. Good, a little bit more. A bit more. Great. Now, big wheel back. See the lumen? Go on, big wheel back. Go on. Trust it. Big wheel back. Right, let me show you. Let go. Don't worry. The scope won't go nowhere. Excellent. So, you've got the big wheel back. You've got it back to there. It can actually go a little bit further back. For some reason, you're stopping yourself pulling it back. Okay? So we've got the lumen. We can see where it wants to be. Underneath the fold. Big wheel all the way back. Clockwise torque, anti-clockwise, clockwise, anti-clockwise, and that opens up that area for you. Okay? Again, big wheel back, anti-clockwise this time, clockwise, anti-clockwise, anti, and there's not a lot of gel on this scope, I'm afraid. Can you go back onto his left? Right, so we take the scope back. The scope now, because we've changed position, will always need to be relaxed. So as we come here, watch the scope. Watch what we do.
Yes.
Anti-clockwise. You're going to do this in a second. Anti-clockwise. Keeps the scope in this plane. So all I do is stand relaxed. Big wheel back, slowly. Clockwise torque. And that is just moving this fold around for us. Okay, so again, anti-clockwise, advance. Let the scope come round, and it's round. Okay? Now, I want you to just put your hand exactly where my hand is, and keep your hand there. Keep your hand there. Hold the scope. Draw the scope. Hold the scope. I don't want to. Anti-clockwise. You don't let go. You're re-gripping with. That's what I don't want you to do. I don't want you to do that. I don't want you to do that. I want you to hold the scope. Okay. You'll feel the scope once you go the right direction. Steer in the direction. Big wheel forward. Big wheel forward, little wheel release. Okay. Suck. Suck. A little bit too low. Missed that turn. Okay. This is a difficult bit because this is the hepatic, you see. So when you get the hepatic, to make the turn here, suck to bring the fold forward. Allow the scope to rotate into the turn. Suck to bring the fold forward. Suck again to bring the suck again. Back, then go forward. Okay? Yeah? And then you can go forward. So in getting around the hepatic flexure, it is you turn, but then you draw back, you go forward. Okay? Now for this is a test, if you go too far with this chap, we are in the cecum, but I'm not going to out ileum. Okay? So that is cecum. All yours, my friend. So to get around the hepatic flexure, it is in. The fold sits here, and the lumen is here. So to get round, I have to look, but I'm hitting the fold. So to make sure that comes to me, is I suck, I bring it to me. I then can turn in, I then can go forward. What you were doing was turning, but not sucking. Okay? Good man. So just for interest, big wheel back, and blow water. Blow water. That's it, good man. No. Good. That's enough. So there you go. That's the ileocecal valve opening. It doesn't respond to being pushed in. It has to be steered in. So we start coming back now, my friend. Are you happy with that? Sorry? Are you happy?
Yes, we are happy, but we have to enter into the ileum.
You don't have to, because it's fresh rectal bleeding, so we don't need to. But you've just been at the opening. If you want me to show you, I will. So, watch the scope, come in, it's neutral. Suck, suck, suck. It is just there. Draw the scope back. Little wheel is neutral. Blow water. Not air, if it will blow water. Blow water, you silly thing. Because if it just blows air, it blows it away from you. So blow water. I blow a lot of water in these things. That's the appendix. And that's it just there. I don't spend too much time doing it because we don't need to. And it's just really because we've got a number of tests to do today. If I had to get in, I would persist, but we don't have to, my friend. So just keep coming back, boss. Nice and steady. A little bit of air. Learn to talk, steer. Learn to talk. That's better. Learn to steer. Brilliant. Keep coming back. Nice and steady. Nice and steady. Nice and steady. Well done. Good. And down. Keep coming back. Nice and steady. Good man. Anti-clockwise. Well done. Keep coming back. Nice and steady. So, anti-clockwise. Good. Nose up. Excellent. Anti-clockwise. Brilliant. Right. Good. Excellent. Good. Happy?
Yes.
Well done. Yes. Excellent. Clean your lens. Well done. Hand closer to the anus. Good. That's enough. You have to give one more. Now you have to give it back. Good man. That's it. Little there, just a little bit. Better. Brilliant. No, no. No. Never just do what you've just done, okay? Because what you've just done is just you had a good view and you just took your eye off the screen and you thought, oh, I need to neutralise that wheel, and then that just takes your view completely away. Only do what you need to do to change your view on there, okay? Don't just grab the wheel and just go turn, because that's what caused you to lose your view, okay? Excellent, keep going. Nice and steady. Nice and steady. Well done. No, let it come the other way. Let it come the other way. There you go, big wheel back. And now let it go that way. Not the wheel, not the wheel. Allow it to turn, then adjust the wheel. Allow it to turn, then adjust the wheel. Don't adjust the wheel to adjust the view and then draw back, because it's the right things, wrong order. Okay? Hand back. There we go. Great stuff. So keep coming. Keep coming. No, keep coming. Big wheel forward. Lovely. Now what are you going to do? Now what are you going to do? Okay, so how are you going to do it?
Big and small wheel backward.
Get the lumen central first. There. Now what are you going to do? Big wheel and little wheel back. Okay? And little wheel. And then what? What are you going to do with the scope? Okay. Slow it down. Keep it going. And the other way there. Right, we're a little bit too high. Let me just do it for you, and then you can repeat. So we'll just let that go. Okay. So when we do the J, you're right with the big wheel, little wheel. You're a little bit high, so always come down to about 10 centimeters. Pull the big wheel back so it comes back, then the little wheel as it goes forward. Okay. And that's what you can feel dropping down. Okay, so what you've done is that you were too high when you did it. Alright, always come back so you're about 10 centimeters, if not lower. Pull back into the lumen. Keep the scope here, centralized. Yeah, back to here. Big wheel, little wheel, big wheel all the way back, little wheel now. Advance clockwise to anti-clockwise, and it's out. Okay. So.
वाल्व ना, कैसे हम एयर पे हैं? ओके, तो whenever you are withdrawing, so as soon as you see the fold coming across your field, point away from the fold. ठीक है? Let it pass, and when you are past that fold, you can observe it from the other side, as well as go back in and let it open up. It will open up for you. ठीक है? Go back in and just look around it as well. ठीक है? So you should be making circular movements, looking behind every fold, everything, so that you are entirely happy. Now it was coming across my field, so I'll point away, right? Okay.
Same is needed in the upper GI as well, sir.
Upper GI, but upper GI is a lot easier. There is no comparison, right? Okay. So, ठीक है, तो it is a diverticulum. He's got a bit of diverticular disease. ये तो नहीं है खैर, अभी ये सिर्फ इसकी contractions हो रहे हैं, ठीक है? तो hypertrophied muscle है basically. जो अच्छा ठीक है, अब आप उसको वो करें, ठीक है? तो now you do it, ठीक है? अब ड्रॉ करें, ठीक है, that's good. अच्छा अब ठीक है, ये अब withdraw, good. हाँ that is good, that is well handled. अच्छा हाँ ठीक है, now go back. Now you know that the fold will come across from 2 o'clock position, ठीक है? So you point your scope towards 7-8 o'clock. नहीं इस तरफ नहीं ना, आप उस तरफ देखें, हाँ इस तरफ देखें, हाँ ठीक है, इसको हाँ विड्रॉ करें स्कोप, विड्रॉ करें, हाँ. Now that fold will come into view. आप उस तरफ देखें, से away from it, हाँ देख, ठीक है ना? And now see it like that. समझ आई? अब इधर ये आ रहा है, उस तरफ पॉइंट करें स्कोप को, हाँ वेरी गुड. नाउ अच्छा वापस जाए, क्योंकि यू नॉट सीन बिहाइंड दोस फोल्ड. इधर, हाँ इधर देखें, ऊपर करें, हाँ विड्रॉ करें, थोड़ा सा ऊपर देखें, लुक एट देयर एंड विड्रॉ योर स्कोप अ बिट सो दैट यू कैन गेट म्यूकोजल डिटेल्स. ठीक है, दैट्स गुड, एक्सीलेंट. नाउ पॉइंट अवे फ्रॉम इट. अब दूसरी तरफ इसको मोड़ें, हाँ दैट्स इट. अब अगेन कम आउट, या okay, withdraw. Now you can see that fold coming towards you. Point away from it, that's good. Okay, now withdraw. That's excellent, good. Keep it central, that's nice. But look around the fold. Now this is coming into your view, go back in. Acha. Now as soon as it comes into your view, point away from it towards 11 o'clock. ठीक है, you've passed. ठीक है, that's good. Withdraw, that's good. Now go back, dip, नहीं, विड्रॉ नहीं, बाहर निकले ना, देखो उस आप, हाँ इस फोल्ड को आपने देखना है दूसरी तरफ से. विड्रॉ, हाँ दैट्स इट, होल्ड इट देयर. नाउ गो बैक एंड लुक एट दिस फोल्ड. नाउ दैट्स इट, फाइन. नाउ कम आउट अगेन. ठीक है, उसको देख लिया ना. हाँ, नाउ कम आउट, दैट्स ओके, फाइन, कीप कमिंग आउट. अच्छा यहाँ यू कैन सी दिस कमिंग फ्रॉम, हाँ लुक अवे फ्रॉम इट, कम आउट, एक्सीलेंट, दैट्स गुड कंट्रोल. ठीक है, हाँ अब इसको देखें, दैट्स गुड, एक्सीलेंट, फाइन, कीप इट लाइक दैट. अब ये नीचे से आ रहा है, पॉइंट अप अवे फ्रॉम इट, लेट इट पास, कम आउट, उससे अवे करें, हाँ लेट इट पास. ठीक है, हाँ अब इसको देखें ना, इट वॉज ऑब्सक्योरिंग योर व्यू, नाउ यू कैन सी इट बेटर. ठीक है, अब इसको इस तरफ मोड़ें, ना दूसरी तरफ, चलो ठीक, हाँ ठीक है, हाँ ऐसे. अब इसको उस तरफ मूव करें, सॉरी. अच्छा ये जो है ना, यू मिस ऑल दैट सेगमेंट, गो बैक अगेन. पॉइंट अप, अब उधर थोड़ा सा विड्रॉ करें, हाँ उधर अप, ऐसे, शाबाश. नाउ यू एंश्योर दैट यू एग्जामिन द पार्ट विच जस्ट फ्लू पास्ट यू. ठीक है, इधर देखें, ये जो इनके मसल जो है ना, सर्कुलर मसल हाइपरट्रोफी है इसमें. ये काफ़ी प्रोमिनेंट है ये फोल्ड्स, ठीक है, ओके, कम बैक, और दे आर sort of
You tell him I'm not going to be. It's not that I'm being serious. It's just that I realise if you don't understand me, if I'm saying something stupid.
Understanding is a little bit difficult.
Not a problem. What I'm saying is, I don't want you to feel. If I keep things very, very short, it's not that I'm annoyed or anything like that. It's just that, you know, and I mess about a bit. I won't mess about because otherwise you'll be, hey. So I will keep it simple, not because of any other reason. And it's just really for understanding.
Excellent, good. Yeah, that's good control. Look up a bit. That's fine, good. So make sure that you are not missing. You don't miss anything there. ठीक है, draw करें, शाबाश sir. That's good. Keep it going. Good. अच्छा, अब नीचे देखें वहाँ पे थोड़ा सा फोल्ड है ना, ठीक है, हाँ देख लिया आपने, तसल्ली कर लिया अपनी, that's good. Good, हाँ, शाबाश, that's good. You can always, if you are unsure, you can always wash. ठीक है, that's good. हाँ, ठीक है, सही है. हाँ, आप आए वापस, that's good. ये यहाँ पे फ्लू पास्ट.
Then we come back.
हाँ हाँ, बोल रहा है. तेरे मैं अंदर कंप्यूटर से देख चल रहा है. होता है ना, इसको तो आपने वो किया होता है
रोक नहीं
ना.
सकते सर हमें?
हाँ नहीं, रोक तो नहीं सकते, मतलब तो आप दोबारा चले जाते हैं ना, कोशिश कर सकते हैं, लेकिन रुकता नहीं, बाद में होता ही है, यू कांट. ये तो हर एक से होता है, ये आपकी वो नहीं है, ठीक है ना, तो डजेंट मैटर ना, क्योंकि ये तो फ्लॉपी सा ट्यूब होता है ना. बाद वक्त ये होता है कि बाद लोग जो है दे गिव बस्कोपैन इंजेक्शन एट द टाइम ऑफ विड्रॉल,
अच्छा.
कि ये पेरिस्टाल्टिक मूवमेंट मिनिमाइज हो जाए ना, जैसे यहाँ पे आपका है ना.
रिट्रोवर्जन बता दें थोड़ा इस स्टेज.
रिट्रोवर्जन तो अभी आप पहुँचे नहीं है ना.
20 आ गया सर.
हाँ,
It is 20.
अच्छा, किधर है आप?
We have to do retroversion at 30 sir about.
नहीं 30 नहीं करना था, आप पहले आते हैं एनल वॉइस तक आते हैं.
Okay.
आप हवा में तो रिट्रोवर्जन नहीं करते ना,
Okay sir.
वरना कोलन फाड़ देंगे.
Okay sir.
हाँ, ठीक है. आते जाएं आहिस्ता आहिस्ता. अच्छा, ये देखिए ना, आप इसमें रेट्रोवर्जन आप नहीं करेंगे क्योंकि ये म्यूकोजा इन्फ्लेम्ड है, ही गॉट प्रोक्राइटिस.
Okay sir.
नॉर्मली आई डोंट एनकरेज इट क्योंकि
Okay.
फ्राइबल होता है, आप वो होता है. इसकी आप बायोप्सी लेंगे अभी.
Okay sir.
थोड़ा सा अंदर जाए, कितना कहाँ तक आप आए हैं? अच्छा, अब बिल्कुल डिस्टल प्रोक्राइटिस है इसको, ठीक है. ये अपना ज़रा यार इसका वो ले लें बायोप्सी से, ठीक है, और फिर अच्छे बच्चों की तरह बाहर निकल आए. वालेकुम सलाम, क्या हाल है बेटा? हाँ जी, और ठीक ठाक. गुड. वसीम, तुम भी यार अपना प्राइवेट क्लिनिक खोलो, एंडोस्कोपी किया करो, तुम तो इनसे ज़्यादा अच्छा करोगे. तुम्हारे लिए तो ये बहुत आसान है, इतने तुमने देखे हैं कि, और हर एक को देखा है कि कौन किस तरह करता है. मैं बहुत पहले पहले आया था कोई जो यहाँ पे वो पीएचडी का बहुत पहले वाला हुआ था 2006 में था कि 5 में था हाँ
उसमें मैं नहीं था उसके
उ-
फौरन बाद
हाँ उसके हाँ
फर्स्ट वाले
फर्स्ट वन पे मैं हाँ उसमें फिर अभी ये जो दूसरे में तो खैर अभी आप थे हाँ क्योंकि उस वक्त मेरे ख्याल में और लड़के थे कोई लेकिन खैर ये भी साधनात ने बड़ा कमाल किया कि ये जो यूनिट डेवलप किया ना बहुत बहुत मेहनत की है क्या हाँ
Excellent. Well done. So just tell me what you're doing. Don't have to be in English. I understand. Tell him. Okay, just stop where you are now. If you continue to go in this fashion, you will cause a corkscrew. It just keeps going in this way. If you allow the scope to relax, right here, just relax.
The endoscopist's view of the anatomy is simple, with prominent folds, the valves of Houston, sometimes skin papillae at the opening, and then the squamocolumnar junction or dentate line, which is seen here on inserting the endoscope. Famous of the rectum. Retroverting
If the patient's comfortable, no problem. Don't suck. That's what you shouldn't be doing.
Pain over. He's having a pain.
Now
Just
you,
ask
And now
him.
on with the number.
you tell me. What do you want to?
Want to go in again? All right.
Okay. Look at the screen.
बता रहे हैं आपको. कह रहे हैं screen की
Suck
तरफ देखिए.
just a little bit. Bit more. Bit more. Stop.
बस.
Now come back.
वापस आएं.
Come back. Slowly. Slowly.
आहिस्ता आहिस्ता.
The fold is coming into view. Now
Fold
what
आ रहा है.
is the fold is, and as you bend, so back. More.
और थोड़ा. Slowly.
Slowly. Go on. Come back.
वापस आएं. आएं.
No, 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 no.
ये नहीं करना.
This hand never comes off. Never comes off.
उसी से करें. Right hand.
Okay. That's it. Come back with the scope. Come back.
वापस आएं.
Come back. Come back. Now. That's the fold.
वो fold था. ठीक है.
Now. That's it.
Yeah. Yeah.
Go on. Yeah, you can see it. So, big wheel back.
Big wheel down करें.
Yeah,
इसकी
go
करीब
on.
जाके.
Go on.
कह रहे हैं. Big wheel down करें यहाँ पे. थोड़ा वापस खींचें. आहिस्ता आहिस्ता.
You're blowing. That's the problem. Now all of a sudden you're becoming a little bit disjointed. Just come back. Slow. Stop. Now. Here. Big wheel back. Big wheel back. Big wheel back. So take it back. Come back. No suck. Okay. No worries. my friend.
For me.
That's enough for you.
Yes, sir.
You're easily pleased.
तो कह रहे हैं she's having a pain.
Okay, no worries.
अब समझ आ गया है. Do you know the principle?
I think that's admirable that he said that. So
अब बताएं क्या कर रहे हैं. What are you doing? वापस आ रहे हैं. He's saying he's coming back.
okay, what else are you doing?
कह रहे हैं और क्या करना चाह रहे हैं.
So clockwise,
कह रहे हैं clockwise करें.
anti.
एंटी क्लॉकवाइज और क्लॉकवाइज दोनों तरीके से वापस आए ताकि आप सारी साइड्स देख लें.
Excellent. Can you see how that bulges in just there to the right? That's because there's too much air in the small bowel now from before. So, because the small bowel indents on the side. So this one, you got to the terminal ileum and you never let go of the scope. On the course, have you done that before?
कह रहे हैं पहले कभी आपने किया टर्मिनालियम में से.
Yes.
You have done it?
Tried a lot, but I have passed only 2 times.
Only 2 times.
Well, all on here today, is this the, have you ever, how many times have you gone from all the way to the terminal ileum without somebody else taking over?
No, sir.
Never.
The support of supervisor, I have done myself 2 times.
2 times. 2 times. Or whenever you're doing a case, so
Did
somebody
the
else
supervisor
takes
have to touch the scope? But today all I did was put the pressure on and he steered it and supported it. So it's getting him to do the scope, hold the scope, so he knows what the pressure is. That's the difficulty when you're doing these things. It's not that the fact that I like to embrace him from behind, it's the fact that you've got to be able to do and help people, because then they realise. And when I let go of the scope, because I would let go and wait for it, these fingers keep in contact. And if I didn't feel the tension was being maintained, I would then re-grip, because that supports it. And he maintained the grip all the time, so he actually knows what he wants to do. Yeah.
I want to ask one thing. I was watching a video. What I was saying, the guy went in by stepping the
Yeah.
scope, the through the sigmoid straight. He said that the chances of roots are really less by stepping
Well,
the
yeah,
scope and going like
but
straight.
it will cause a little bit more pain.
More pain, therefore.
That's a surgical technique. Seriously, he'll have been a surgeon who would have done
I
that.
don't know, but these are ASG videos, ASG
Yeah.
guideline.
Yeah. The theory is that it helps keep the scope stiff in the right, and then it able to traverse the transverse colon, and that's what they say.
What's your experience about this? Do you do that?
I don't. I mean, here now we've not used stiffness at all. The majority, I do use stiffness to withdraw. Yes, I'll go back in 4 or 5 centimetres with it. Then I'll reduce, back again, and forward. I don't use it a great deal for anything other than that. I think stiffness itself can cause a little bit more pain. So, there's this scope that I'm going to be trialling in November, the robotic colonoscope. So I'm going to be trialling that, and I'm going to get one for Saad to try, and you can use
the joystick.
It's a joystick. You could do it. I could scope someone from Karachi back in the UK with it. So, I'm going to. You don't need to do it. I will talk to you about it. Don't need to do it. And so what? So what are we going to do? So where? You come back another centimetre. Come back. Come back. Where are we? Okay. Is she better? Yeah. Right. A little bit of air in. A little bit in. Now, how are we going? What are we going to do?
No need of retroversion.
I'd say to you that retroversion is probably as important as trying as what is trying to get an eternal alien. Okay, so
Yes. Yes.
so slowly pull the big wheel back,
Yes.
all the way back.
Okay.
Got to be some pain. Okay. All the way back.
Back and fully.
Little wheel all the way back.
Both are back.
Okay.
Now.
Now, torque.
Clockwise,
Anti-clock.
anti-clockwise.
Yeah.
Anti-clockwise.
Yes. Advanced though, as you do it. Now clockwise. Great. There. How's that?
Very nice.
Excellent. So ulceration just there, haven't we? You just see where the yeah. So now what you do, she's definitely got a fissure. So just let go of the wheels. No, just let go of them. Let go. And allow suck on down and allow the scope to come back slow. No, just allow it to come back. Allow it to come back. And that's it. Done. Yeah, this I don't touch it. I keep messing with it and you keep telling me